Welcome to the Washington County Community Health Improvement Plan Forum. My name is Laura Daly, and I am the coordinator for the Community Health Improvement Plan. This recording is a follow-up to a session that we held on November 4th, 2024. We had some problems with our interpretation channels in Zoom, so we are recording this session in both English and Spanish so people who were not able to participate on November 4th have this information. We will have the slides displayed here in English, but a Spanish version of the slides is posted on the website with this recording if you'd like to follow along. I want to acknowledge that we updated the content and the order of the slides here. So if you attended on November 4th and are now watching the recording, just know that there are a few small changes to make things easier to understand. So today we will provide some information to orient you to this topic, and then we will talk about the history and the context of the CHIP, or the Community Health Improvement Plan, how data and community inform the Community Health Improvement Plan, and our plan for the next CHIP that we will be developing. We use many acronyms in this presentation, and in fact, on the last slide, we use the acronym CHIP repeatedly, which stands for Community Health Improvement Plan. We try to define acronyms before we use them, but we have this slide as a reference for you as you follow along. I encourage you to pause the video and take a photo of the screen with your phone or take a screenshot, and there are instructions on how to take a screenshot in the top right corner of the screen. I have already introduced myself, but I want to pause on this slide and recognize the team of people at Washington County who helped put these materials together and ran the forum on November 4th. For this recording today, there are only two of us presenting, and I will hand it over to my co-presenter so she can introduce herself.
Hi, everyone. My name is Genevieve. I am a senior program coordinator with Washington County Public Health on the strategy team, and I support with our health equity and community partnerships work.
Thanks, Genevieve. I also want to recognize that there are many people at Washington County who participate in the CHIP broadly beyond just the people listed on this slide who planned the forum. This is a huge project and we couldn't do it without a big, incredible team of people. Okay, now we are going to move into some information about the context and history of the Community Health Improvement Plan. And for the rest of this, we will be off camera so that you can just focus on the content. Okay, first, what is a Community Health Improvement Plan? A Community Health Improvement Plan, or a CHIP, is a strategic plan for the community's health. Community could mean city, county, or lots of other different things. In our case, it is a plan for the county, so it includes all the communities in Washington County. A CHIP identifies priority issues about the health of the community and the people in the community. And it identifies goals and strategies to address those issues. Like the name implies, it is all about trying to improve the health and well-being of people in the community. It is a collaborative planning process that includes significant involvement from our community partners. We absolutely do not and could not produce a CHIP all on our own. For it to truly represent the community, it has to be a joint plan created by partners from all different sectors and representing all different perspectives. We have community-based organizations, health systems like clinics and hospitals, school districts, and many other partners involved in all different parts of the process, which we will go over in a minute. The CHIP also needs to be based on a community health needs assessment, abbreviated sometimes CHINA. Our community health assessment is one we participate in regionally with Multnomah and Clackamas counties, and we'll explain more about that in just a moment. And then the CHIP is a required part of national public health accreditation, and Washington County Public Health is an accredited health department. This means that we meet certain national standards for the work we do and the services we provide. You can see on the right here in these boxes, there are some of the requirements for National Public Health Accreditation for the Community Health Improvement Plan. You can see that it needs to have timelines and roles identified. It needs to have measurable objectives, and all of the other things here in these boxes. Now that we've talked a little bit about what a CHIP is broadly, we will now be talking specifically about Washington County's CHIP, which is known as Live Well Washington County. We released versions in 2014, 2017, and in 2020, and we are starting on our fourth version now. You can find these on our website. We will have a QR code at the end of this presentation that you can scan, and we'll have the website linked in the PDF of these slides. For our current CHIP, the one that we released in 2020, our foundational goals are to improve health equity, address disparities, and use a trauma-informed approach in all the work that we do. We call these our foundational goals because we want them incorporated and woven into every part of our CHIP work. Our priority areas for the CHIP are the broad topics where we focus our efforts. These are areas that were identified as needs or places where we can do more to improve health outcomes. And these are improve access to care, improve behavioral health outcomes, and build systems to improve well-being. And you can see we have this figure on the right of the screen that shows how we currently have our CHIP structured. You can see on the outside, we have the priority areas listed. And then we have several committees that help plan and implement the CHIP priority areas. These committees are a mix of Washington County staff and community partners from many different organizations. And you can see these committees in the colorful part of the circle. Starting with the red and going clockwise, they are the Access to Care Committee, the Aging and Connection Committee, the Youth Substance Use Prevention, Suicide Prevention Council, and the Healthy Communities Committee. These are how the committees were set up when we released the latest CHIP in 2020, but they have shifted over the last 4 years. Some of them are still meeting and are doing great work, and others have paused or disbanded. Some of this is due to the COVID-19 pandemic, and some of this is due to a lack of direction or support from Washington County. And that is something we are looking to improve going forward. We want to structure and support these committees so they can implement the CHIP priority areas effectively. So these are how the committees exist now, and in the next year, they may change a little. And then finally, the chairs of these committees form the CHIP leadership team in the middle of the circle. And the leadership team is focused on making sure that the efforts of each of the committees are aligned with each other, and that we are incorporating those foundational goals into all levels of our CHIP. And I will pass it to Genevieve.
Thank you. So next, we will be zooming in and talking about how data and community inform the CHIP. First, we're going to walk through the process of developing a CHIP. And I just want to orient you to this slide. You can see steps 1 through 5 in a circle on the left with community at the center. On the next few slides, I will share a bit about each of the steps that you see here, what we've done in the past, and some processes we're hoping to develop with you all over the next year. We will also look at a timeline for this work in a few minutes. Next, you can see on the right-hand side the list of priority issues. These are the broad priorities that guide our Bridge CHIP. We have drivers of health, health promotion and prevention, and access to care. We will talk more about these in step 3, but for now they serve as placeholders. Then underneath, you will see a rainbow with the different levels of CHIP collaborators. Starting with the outermost pink layer, that is all of you, as well as many partner organizations that we work with to create and implement the CHIP. These folks are involved throughout the community health needs assessment or CHIP process, but particularly in steps 1, 2, and 4. Next, you will see the orange layer, which are the community-led priority issues. Many of you have been involved in these committees in the past or will be involved in the future as we relaunch this work. These have included the ones that Laura just reviewed: access to care, prevention, and the Aging and Connections Committee. Third, you will see the blue layer, which is the CHIP leadership team. We will be working with a small group of partners over the next year to think about what the leadership structure looks like. Traditionally, this has been the co-chairs of each of the committees. Finally, you can see the inside of the rainbow where it says backbone support from Washington County. This is meant to recognize that the CHIP is not a Washington County public health plan. It is a community plan that is facilitated by Washington County public health staff. Step 1 in the CHIP process is to conduct a health assessment. In Washington County, we participate in a regional community health needs assessment, CHINA, called the Healthy Columbia Willamette Collaborative. HCWC includes Multnomah, Clackamas, and Washington counties, and all of the hospitals and health systems in the region. The purpose of the regional CHINA is to reduce the burden on the community, as all 3 counties and the health systems need to complete a community health needs assessment every 3 to 5 years, and they would be engaging with a lot of the same groups to do that. So the regional assessment allows this process to be more coordinated and reduce the burden on community. The downside is that the data we get out of the CHINA is less focused on our specific community because it's not just Washington County. Because of this, we also compile additional data that is Washington County specific to supplement the regional CHINA data. An updated CHINA is currently scheduled to be released in October 2025. Earlier this fall, we shared the HCWC survey and encouraged partners to send it to their networks. While that survey closes soon, we also need help identifying other data that we want to include on top of the CHINA. This could include data specific to your communities that your organization collects or knows about. We plan to have opportunities this spring to discuss this with partners and to hear from all of you about any additional data that you would like to see included. Step 2 in the CHIP process is to review data with partners. So what this has looked like in the past is we have put together a presentation that pulls out Washington County specific data from the regional CHINA and combines it with our supplemental Washington County data. We also apply an equity lens to this process. So this could involve looking at data by race or ethnicity, geography, education level, language spoken at home, or other factors where we know health disparities exist. This supplemental data might also include data from community partners and from local programs. In the past, we have then brought that presentation to different committees to hear community feedback on how we are interpreting the data and to get their insights and perspective. Over the next year, as we work through the Bridge CHIP process, we want to work with our partners to determine what the best process is for bringing this data to spaces where we can then review it with you all. After public health and community partners come together to review the data, We will want to make sure that our priorities reflect the community needs and also represent the work that we want to focus on together. As you can see, our placeholder priorities are very broad, so there's a lot of work that can fall under each of them. And I have a very messy photo that illustrates what a process looks like of making sure that our existing work fits into these priorities. The current priorities for the bridge chip were selected to align with the CCO, Coordinated Care Organization chip priorities, and they are meant to encompass all of our existing work. But we will have a chance to develop new priorities together next year. In the past, Washington County Public Health has facilitated discussions with the CHIP committees and groups of partners around what the data mean for your community and your organization's work. As an example, in these facilitated discussions, we ask partners to reflect on whether we need to make any changes to the priorities based on the new data. This is another process, how we come together with partners to select priorities and strategies, that we are hoping to refine over the next year. So look out for other engagement opportunities coming in the spring. Once the priorities are set, we move into selecting and implementing strategies. The priorities are broad topic areas, and the strategies are more focused on what and how we want to do the work. Again, in the past, this strategy selection has taken place in the CHIP committees. Committees have also had a set amount of funding to use for projects to help move the work forward. The CHIP leadership team has also led a grants process to get the funding out to community partners, focusing on the priority areas. Examples of previous grant-funded projects can be found on the CHIP website. However, the Bridge CHIP is a chance to rethink how we get those funds out to the community. For example, committees could decide how to use more of that money, rather than a competitive grants process. And here is an example of what a process could look like moving from broad priorities like access to care to strategy selection. And strategies could include traditional health workers or vaccines, to implementation. So how we support the workforce and think about sustainability, create mobile clinics for vaccines and combat misinformation, and include resources, time, and staff capacity to support the work. Step 5 in the CHIP process is evaluate impact. And there are a lot of ways to think about evaluation. So this is another area where we want to make sure we're talking with community partners about how we want to measure impact. We also want to make sure we're thinking about evaluation from the beginning so that we know what we want to be tracking. There are existing frameworks and tools for evaluation, so we can draw from existing resources as well as from discussions with partners to collaborate and figure out what makes the most sense for Washington County to evaluate impact. Washington County Public Health will also provide support for partners with implementing whatever evaluation framework and tracking processes we end up using. So once again, the Bridge CHIP will help us to develop and propose an evaluation framework that we can bring to partners and refine prior to starting the full CHIP cycle. And I'll pass it back to Laura to continue our presentation.
Thank you. So now we want to review our plan for the next Community Health Improvement Plan and the work that we will be doing in the next 2 years. Our previous CHIP was from 2020 to 2023. So we are in a place now to complete a new CHIP. But we have several things happening that have made us pause and think about how we want to do our CHIP work. I'm going to walk through this figure to explain our proposed process. I also want to acknowledge that we revised this figure a little bit from when we presented it at the CHIP Forum on November 4th. We hope it is a little bit easier to understand with the way that we've revised it. So the first thing making us pause are these things over here on the left part of the screen. First, there's the community health needs assessment that Genevieve just talked about. If you remember from previous slides, a CHIP must be based on a community health needs assessment, which we do with our regional partners. It was last completed in 2022, and the next one is set to be released in October 2025. So we are in this in-between period where we could base our CHIP on this older assessment, or we could wait for the new one. On top of that, we have been doing a lot of community engagement in the last year and all throughout the COVID-19 pandemic. We did focus groups, interviews, tabling sessions at events, and we did a survey to find out what partners are interested in doing related to the CHIP. We received great feedback about how we do the CHIP and how we involve community in our work. We also got lots of feedback about how we communicate about the CHIP and how we run the CHIP committees. So we are identifying many areas where we can improve. And then finally, there is a lot of great work happening at Washington County with many exciting plans and projects in progress. And we need to take a moment to make sure our CHIP is aligned with some of the work happening in these plans to make sure that we are coordinating and not duplicating our efforts. So given all of these, Given all of these factors, we're planning to do a bridge CHIP, which will be released in July 2025. Essentially, this is an interim plan that connects the work of the previous CHIP with all the process improvements and feedback we want to incorporate into our future work. A big component of this will be focused on process improvement and on how we conduct our work, because the how we do the CHIP work is what allows and encourages community partners to participate and feel heard and to have the CHIP truly reflect community priorities. So once the bridge CHIP is released, we'll work on doing these improvements we've identified, which include thinking about how the CHIP leadership and committees are structured. Do we have this all set up in a way that supports the CHIP work? We also want to think about improving how we communicate about the CHIP to partners. Do people know when they can participate? Do they know what's going on? Are we being transparent about the work we are doing? We also want to set goals, objectives, and metrics, and a clear way for community partners to be involved in all of that. We also want all of this information to be transparent and accessible to anyone in the community who wants to know about it. And then finally, we want to think about how we run our community grant program. We heard from some partners that a competitive process does not work for smaller organizations. So we want to take a hard look at how we distribute funds and make sure we are doing that in an equitable way. In October 2025, the new Community Health Needs Assessment report will be released, and we will take the data from that, plus the extra data that we collect, and we will work with community partners to identify priority areas for our new CHIP. During this time, we'll also be working to make sure our CHIP is aligned with other Washington County work and plans. And finally, we will be taking a look at how we can incorporate policy into our CHIP strategies. If you remember from the slide about public health accreditation, part of a requirement is to have policy recommendations for improving health, and this is something we want to strengthen. All of this will flow into releasing a full CHIP, Community Health Improvement Plan, in July 2026. This is our very high-level proposed timeline for our work for the next 2 years. So this timeline is to give you a bit more of a concrete idea about when and how you can participate in the process over the next 2 years. So January through June 2025, in this section right here, we will be doing a lot of work on making a plan for those improvements we just talked about. And we expect to hold a few events where we can check in with partners and partners can offer feedback on our progress. And you'll note here that we also have listed up above, this is where in the process that Genevieve talked about, we are conducting that health assessment. That survey is open right now, it is about to close, and we will be working with partners during this time frame to collect supplemental data. In July of 2025, we will release the Bridge CHIP, and we will start the process of reconvening our partners and getting our committees organized, because in October of 2025, the new Community Health Needs Assessment will be released. And we will start step 2 of the process where we review all of that data with partners. From January through June of 2026, we'll be working with partners to pick priority areas, pick goals, and pick strategies for achieving those goals. And we will also select metrics or measures that we will use to track our process. And that is that step 3 that we talked about. And then in July of 2026, we will release our new CHIP and we will start working on implementation. We'll work with our partners to put all of those strategies into practice, and we will also be evaluating our impact and measuring how we are doing. That is the end of our content for this presentation, but we want to close out by saying we hope you will stay connected to our CHIP and help inform all of our planning over the next year. The best way to do that is to take the CHIP survey if you have not already done so. That is on our website. It will be linked in the PDF of the slides, or you can scan this QR code, and that will let us know that you want to stay in touch with us, and you can indicate what areas of the CHIP you are interested in participating in. Thank you so much for listening to this recording. And if you have any questions or feedback about the CHIP, you can email us at this email address here. Thank you very much.